All right. Well, today's an unbelievably exciting conversation of health insurance, but we know it's a massive concern for anybody retiring out of the government sector. Part of the reason that we know many people go into work in law enforcement or government sector period is for benefits, and one of those benefits is health insurance. So it's no question and understandable why so many people are concerned about retiring and how their health insurance is going to be affected by that. You have loved ones and you care about them. And so we understand that. So today we're going to start talking about and peeling back the layers of what you should understand to eliminate that fear that you currently have. Enjoy. Welcome to the Cedar Harvest Show, where we focus on financial education for a variety of things that affect not only your life, but also your spouse, children, charities, and your legacy. We discuss everything from health insurance to pensions, wills and trusts, to the best way for everyday tax planning. Our intention is to bring financial and legal professionals together with everyday people who need their help. We have real conversations with real people who have real questions and scenarios. I'm your host, Mario Lizarraga, and today's show is part of our law enforcement series, so I'm happy to have our co-host, Officer Ty. Welcome.
Hello.
18-year law enforcement officer, currently employed here in Arizona. Today it'll just be Officer Ty and I, but a lot of times we do bring in a lot of different special guests. But today it'll just be the two of us. And we're happy to talk about, today we're going to talk about specifically about health insurance.
Yep.
One of the big questions I seem to run into with a lot of government employees, doesn't matter what sector they're in, everybody's concerned about health insurance. So, a little background on myself is the fact that I am a health insurance agent. That's how I got into the insurance profession, as I was just looking as my new career path while I was kind of in between my next business venture. So I'm happy to kind of peel it back and help explain to you any questions you might have. I believe, Officer Ty, you have some other questions that have come in from some other officers.
I actually have questions from a couple friends who asked, and their questions revolve around health insurance. So
Perfect. Well, health insurance is it's definitely a necessary evil. We all hate it.
yeah,
We all hate it, right? Even insurance agents, we hate it.
open enrollment every year.
But we understand it, right?
Yeah.
I mean, well, we love to hate it. You know,
Yeah.
I mean, it's just one of those things that, we all hate it until we use it, and we're happy we have it when the time comes, right? But up until that point, until we're just happy, healthy, there's no problems, we feel like it's an absolute waste of money,
Yeah,
right? Is that fair to say?
yeah,
And it's also probably fair to say that you guys also probably a lot of people I know, a lot of my family, they're government employees. Part of the reason they chose that path was because they didn't want to worry about benefits. They felt like they were going to have the best benefits by having this government position. Is that accurate? Did you feel that way?
I didn't feel that way.
No?
No, I didn't. But there are a lot of officers that do feel that way. It's funny because a lot of the things that I think typical officer or why people go into the law enforcement career, pensions, like the health insurance, things like that, like they look at, I didn't look at any of that. That's not really why I got into it, but that seems to be the big, I think we talked about it before, the health insurance, especially when they retire, that's always the big issue for officers because it's the thing, like a lot of them will stay on the department longer or they'll stay in their job longer because they keep the health insurance benefits because, we're typically you get really good benefits through the city, whatever city or county that you work for, you typically have really good benefits when it comes to health insurance. So,
Well, the fact that you are telling me that you really didn't get the, look into the job for the benefits just tells me that you're very fortunate and you are healthy and you have healthy children and everything's, so you haven't really needed your health insurance. And anybody who has family or, especially children, spouse who has some sort of health ailment, this is like at the top of their list.
yeah,
Right? Having the best benefits,
I can see that.
right? And so it's a big deal. So the fact whenever I hear somebody like, it's not that big a deal, that just tells me good for you. That means you're healthy and you haven't really had to lean on your health insurance yet.
Yeah.
So hopefully you stay that way for years to come.
A lot of that stuff I didn't think about when I was looking at the police departments.
Well, you were 14 when you started on the academy?
I wish I started earlier. It would have been done earlier, but no. Yeah, this definitely wasn't the stuff I was looking at.
Sure. Well, that makes sense. I don't think a lot of
I also
you didn't have a family at the time when you started.
No, I
right?
didn't have a family at the time, and I really didn't know. I was still young. I was still in my early 20s, so I didn't know anything about that kind of stuff. I didn't know part of why a lot of this has come up. Like I didn't know anything about planning. Like I wasn't looking ahead. Wasn't thinking about health insurance. I wasn't thinking about pensions. I wasn't none of that stuff. I wasn't even part of my thought process.
Right. So here we are.
Yeah.
2 years from retirement? Possible retirement?
October 2018.
Yeah.
I'm sorry, 2018. Jesus. I wish. No, 2026.
Okay. So it's good. It's a good time to start looking at it. So let's peel back a little bit and help uncover some of the mysteries of health insurance because everybody's confused about it. I see it all the time. That is what you could say arguably is my primary career right now is
health insurance.
Is health insurance. In-house at Maximize Asset Protection here. I am our in-house group specialist.
Okay.
And I also do individual insurance also, whether it's ACA plans, often referred to as Obamacare, whether it's ministry.
What does that stand for? ACA?
Affordable Care Act.
Okay.
And but street name Obamacare.
Okay.
People think it's an insurance plan. It is not an insurance plan. It is a government subsidy program. And basically, what's going on there? Let's just peel back a little bit and explain that. It's not insurance. Obamacare is not insurance. The government's the government. The insurance company is the insurance company.
Okay.
Okay. The insurance company is who still sets the price of cost of insurance, which is kind of predicated on where you live and how old you are.
Okay.
And they're the ones who determine that retail price. And basically, the government came through and said, "Hey, look, insurance companies, we do not like the fact that our citizens have to pay these exorbitant prices, and we're going to create a program where we're going to help offset the citizens' cost of insurance, as long as you build plans that meet these certain criteria. That certain criteria are called the 10 essential health benefits.
Okay.
Right? Pre-existing conditions, maternity coverage, mental health benefits." Acute care. There's 10 benefits that a plan has to offer to be eligible to receive this government subsidy. And what that means is that based off the government said, hey, you as a citizen should only pay a certain percentage of your household income towards the cost of health insurance and the cost of health care.
Okay.
So based off of your tax return filings, how many people are on your tax return in your house, and how old you are, that's going to determine the cost of insurance in perspective to your income.
Okay.
The government then has a formula that basically saying, hey, we only want you spending a certain percentage. So if the cost of insurance for you is over a certain percentage, the government gives you what I refer to as a gift card, which is the tax credit. So they're basically offsetting, they're giving you, and just like any gift card, like you have a Target gift card, you can take that gift card to one mall. That mall is healthcare.gov. And at healthcare.gov, you can use that gift card to shop for plans. So if the cost of insurance for you and your family of 5 happens to be $2,000 and you have a $1,500 gift card, you apply the gift card and your balance is going to be $500.
Okay.
But as you make more money, that gift card gets smaller and smaller and smaller.
Okay.
And that gift card is good money, but it's also dangerous money in the sense of it's going to be reconciled when you file your tax return because the government's giving you an advanced tax credit. So it's not free money, and so you have to be really careful that you manage this gift card properly. And depending on where you fall on the income spectrum, and it's very easy for us to tell, we just plug in all the information and we say, oh, here's what your anticipated gift card will be, the tax credit, and you either qualify or you don't. And the further you get away from 150% of poverty level, the smaller that gift card is. So
what happens if you don't use it?
Let's just say you qualify and you choose not to apply it towards the cost of insurance right then and there for your monthly expenses, you can then use that. You can then apply it when you file your tax return.
Okay.
And you'll get all that money back.
Okay.
That is one of the benefits of going through healthcare.gov versus going what's called off exchange, when you just go directly to Blue Cross Blue Shield, United Healthcare, and better. You can go directly to the carrier and you can buy a plan at full retail price. And the great news is for all you police officers out there who do have pre-existing conditions, or you have a spouse or child has pre-existing conditions, one of the great things about the plans that you guys have with any group insurance is it's called guaranteed issue. They have to take you. They can't ask what's going on in your life.
If you have issues, they have to. Doesn't matter.
They have to take you.
Okay.
Right? Doesn't matter. Type 1 diabetic. You're in the middle of cancer treatments. They have to take you. There's no question of that. And that's one of the big major concerns. And that wasn't the case pre-Obamacare. So most law enforcement officers who are looking at retirement know healthcare from pre-Obamacare, right? So that's when pre-Obamacare, the insurance companies could be very selective. They would ask you a health questionnaire, and they would either take you or deny your family overall, or they might say they'll take you, but we're going to exclude anything pertaining to diabetes, anything pertaining to heart disease, right? They'd exclude anything that was the very big concern for you.
Okay.
And so this is a big. I can't impart that enough on all of you officers out there. You no longer have that concern. Whether it's anybody in your family, anybody on this plan, they're going to cover you 100%. The question is, what plan are you going to, and access to what providers do you have? So it's not a matter of whether or not you can get insured. It's a matter of finding a plan that's going to take you to all the particular providers that you need, and that's where it can get tricky. For people who have very tricky circumstances, and they're all over the place with their health. Unfortunately, it can, I've run into some really challenging scenarios. And Obamacare is great because, yep, don't worry about it. We can get you, coverage for your fibromyalgia and your type 1 diabetes and your cancer stuff that you have going on. And I've seen situations like that where it's really tricky, but a lot of times they have all of these different specialists. And sometimes it can be very tricky to find one plan where all the specialists are in network.
Gotcha.
So one of the huge benefits that you guys have with your plans is typically government plans have very robust networks. You typically have access to some of the best networks that are out there. And when I say networks, that means network of providers, hospitals, doctors, surgery centers, right?
Okay.
Very few plans. And your plans can be, in the past, I know they were a little more, they typically were more benefit heavy than in the individual market. So maybe I should differentiate a little bit. I should back up a little bit and go back into, so you have group insurance, which is what you're on. You have a group plan, right? Part of the department, government plan, right? It's just a group plan, but for the government there. And, me as a company, I have a group plan as well, but for our small little company, right?
Okay.
And then you have the individual market. And the individual market means you're not part of any group. You're just going out there and you're searching. So Obamacare is specific to the individual market. You at any point in time can start your own company, right? Maybe you're going to do off-duty work, and maybe you're going to start doing something, whatever. You just have some side hustle idea.
Okay.
At any point in time, when you start that company, you personally can trigger your own personal group plan. And when you trigger a group plan for yourself, depending on the carrier, you're going to need at least 2 people on the plan, typically 2 different employees, right? Two owners of the company. Like you and a buddy might be starting up something.
Okay.
And, that'd be 2 owners, and then those 2 guys go on there. Or some other companies require 3, maybe 2 owners and 1 employee. So depending on your scenario, you can trigger a variety of group plans. And why that's important is because the best networks out there, typically those groups require at least 3 employees, 3 people total on the plan.
Okay.
When you only have 2, it gets a little harder to trigger a group plan. Not everybody will issue a group plan to only 2 people, right? And so there's some tricks to it. So you can always go to the individual market. There's no concern there. But if you're looking for the absolute tip-top network, you want to access Mayo Clinic, you want to make sure that you have the best network. Like me, myself, I have access to the Choice Plus network, which I'm willing to bet you do as well. Assuming you're with United Healthcare. I don't know who you're with.
Blue Cross.
Okay, Blue Cross. And I'm sure you probably have their big national PPO network. And some you likely have access to even probably more doctors than maybe I do. But I pay a premium for that. So I'm 49. Oh, sorry, I just turned 50. So I'm 50, and I'm personally paying $770 a month for my portion of our group plan.
Okay.
I have 2 other members on the plan, and they need a variety of specialists. So it's worth it to us as a company to pay extra money so we have access to the best doctors out there.
Okay.
Right? I have a lot of other options in the group arena where I could take that price way down, right? So depending on somebody's health situation,
if you had 3 healthy people, you probably wouldn't need to be.
I would not recommend my plan at all.
Yeah.
Right? Not at all. It's a waste of money, in my opinion, right?
Okay.
So, but any time of year, it doesn't matter what time of year, you can always trigger a group plan if you're self-employed, if you have your own business. Where it's a little more precarious is when you're in the individual market, and in that case, you will have a 60-day window from when you lost coverage. So let's just say you decide to quit the department.
Okay.
Right? Let's say you don't want their COBRA plan, because you can always get the COBRA plan.
Yeah.
Right? You can keep that for 18 months, and you can keep that insurance. Typically, it's pretty expensive. Sometimes it makes sense. I've had a lot of people who are retiring that I recommend stay on COBRA because they have things going on in their life. Or sometimes some COBRA programs are just as affordable as Obamacare. So it doesn't make sense from a monetary
But
standpoint.
it's only 18 months.
18 months.
Okay.
Typically, this is where in the government you guys might have access to some other things that we should look into, right? That's something on the show that we should dive in a little bit deeper.
Like once you get past 18.
18 months.
The 18-month
I'm
period.
pretty sure that I'm pretty sure law enforcement, you guys might have access to some other long-term healthcare options that the rest of the world doesn't. I could be totally wrong, and we should put that on our list of things that we want to
could be on the-
research.
Yeah, I don't know. So
That's a big deal.
okay.
But most of the time it's cost prohibitive. I typically wouldn't recommend it unless you're like on some crazy bone marrow transplant path, and and you're on some crazy path where you need these absolute specialists, don't want to have a bump in the road. Typically I wouldn't recommend staying anyways, because we could typically save you a lot of money and it's not going to benefit you.
Not staying at COBRA, you could find
Right. That's a rare situation where I recommend that. But you do have options, right? And that's the big thing about for any of you retiring out there that you need to understand. You have options. A lot of people, I'm amazed at how many people I run into who are fearful of retiring because they're scared that they're not going to be able to get insurance.
Yeah.
Cost of insurance is the cost of insurance. It depends on the age. It's all age banded. They can't rate you up because you're overweight, because you're sick, because you smoke. They don't. You can get if you on exchange, you're going to pay the full rate anyways. Meaning, if you go to healthcare.gov, which is on exchange, if we go directly to the carrier and bypass any of the healthcare.gov situation, you can get a price break for being a non-smoker.
Okay.
Right. But it doesn't matter if you're 1,000 pounds eating Twinkies every day, smoking like a chimney. If you're 50, it's going to be the same as a specimen like myself.
On healthcare.com.
Healthcare.
Okay.
Yep, that's right. So it's people I think they overthink it, just because that's what they had prior to going into the department.
Okay.
Right. It's a big sense of confusion. So before I can keep going on this, but any questions that come to mind?
So I'll pull them up. So this is coming from an officer who's close to retirement and he's looking at starting a business. So these are some
perfect scenario.
Yeah, so these are some of his questions.
He's in a very flexible position.
Yeah. Let's see. So biggest issue with cop families is they have having to pay for insurance once they leave, if it's not through a business. So I'm assuming he's talking about paying for insurance once he leaves the department, and then having a business on the side. How are you paying for insurance?
Well, so anybody that has their own business, they have options. They do not have to trigger a group plan. Group plans are more expensive.
Okay.
I usually, when I run into a small group, a lot of times I tear them apart. I typically recommend people to go their own individual way, because a lot of times we can play the game with different people. Okay. And it also depends. A lot of it depends on the lay of the land at the time. As we know, our country is very politically kind of divisive right now. It's all over the place.
A little bit.
You know what I mean? So when Obama was in and he started Obamacare, he put a kibosh on which were called short-term plans, because he wanted to get. And short-term plans were designed for more of the healthy people out there. That's what I was on for a long time. All my clients, my mom, my best friend. Anybody I knew that, like, if you were to come to me and want insurance, and I know that you don't have pre-existing conditions, I would have put you on a short-term plan. That plan was about, back in the day, was probably about 40 to 60% of the premium cost of an Obamacare plan. So all of the healthy clients and people out there in the United States were going that direction if they didn't qualify for a subsidy. Well, Obama quickly recognized that doesn't work in the insurance world. We need the healthy people to offset the unhealthy population.
Okay.
Right. So what they did is they outlawed short-term plans when Obama was in. So he did his 2 terms. Then Trump comes in. Trump's like, oh, I'm getting rid of the short-term ban. So Trump's first presidency, first thing he did is he nixed the ability to not buy a short-term plan. So all of a sudden, short-term plans were back. And so again, if somebody were, like your friend here, if they were healthy, I'd be like, well, okay, let's put you on a short-term plan, because all you need is a safety net.
So what? How long is a short term? Like, what's
they're typically sold in 12-month increments.
Okay.
So and again, this is where health insurance. What people don't understand, health insurance has to live up to 2 sets of laws. First and foremost, the federal regulations, and then beyond that, each state has their own individual regulations. So depending on the state you live in, right? They might have their own separate laws to contend with. So us being here in Arizona, we had to, Arizona put its own set of laws, which I'd say were a little looser than other states,
Okay.
right? And so basically, the good thing about the short term plans is it was for a healthy book of business, right? Insurance is costed out. Insurance companies, their costs are what they charge in premium is predicated on geographic location and claims in that geographic location. So the healthier the area, right?
Okay.
The depending on how the cost of healthcare in that area will drive up claims, which will ultimately determine what the health insurance companies say. Hey, this is what we're going to charge you, Mr. 42-year-old male who lives in 85016,
Okay.
right? Or a 62-year-old male. But either, right? And so the short-term plans, what's great about them is they could ask some health questions. Have you ever had COPD, heart disease, da 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 da. If you checked yes to any of those, they wouldn't issue the plan. They'd say, nope, you don't qualify,
Okay.
which that disqualified them from Obamacare, being a qualified plan. Remember the 10 essential health benefits I was telling you about before?
Okay.
So they didn't, because the insurance companies built these plans that were non-ACA compliant, that meant that they were not eligible for government subsidy funding.
Okay.
All right. So for those people, so I would split families up. Okay, let's put your healthy family over here. Let's save you, let's get a plan that's 50%, which is big money.
Okay.
And then, okay, you do have that one kid who unfortunately is a type 1 diabetic, no problem. We've got a plan for them. We will put them individually on an Obamacare plan.
Okay.
That's guaranteed issue that had to take on that type 1 diabetes situation,
Okay.
right? So I could break them up. Well, guess what? Who just left office? Biden, right? And so Biden, as of, I believe it was like September 15th, just killed short-term plans. So short-term plans are no longer available any longer. And so now if your friend retires, they basically are going to have a 60-day window from whenever they lose their group coverage. It's called a special enrollment period, and then they'll be able to apply for an Obamacare plan. And
Is Trump going to bring it back? Is that something he's going to address again?
it's my guess.
Yeah.
That's my guess. I don't see Obamacare going away. It's really
But
helpful.
I mean, like the short-term thing you were just talking about.
I've heard a lot of different. I heard healthcare reform. They've talked about a lot of different things on it. I just don't. I think what Obama did there, regardless of your political, beliefs, we needed to address the situation where people with pre-existing conditions were getting alienated and priced out of insurance. If your child was a type 1 diabetic and needed care, it's not fair that they're raising the cost of insurance on you because you just want your loved one to get help, right? And that was the situation that was going on. So Obamacare kind of fixed that. So I don't see. I know I hear a lot of different talk about what healthcare reform is going to look like. I personally don't think that they're going to ever put a complete kibosh on Obamacare until it's going to be like a total nationalized healthcare system. But I do see Trump bringing back the short-term plans.
Short-term, okay.
Right? That's my guess. Is that going to be in 6 months? Is that going to take a year? It's who knows when he's going to do that and trigger that. I really don't know. But you're getting back to your friend's question. He's not going to have a problem getting insurance. It's just going to be, depending on his age and depending on his kind of coverages that he's looking for. Because reality is there's 100, I believe there's 100, is either 99 or 101 plans on healthcare.gov right now.
Okay.
There's a lot of plans. And so depending on what deductible level and copays and all these things they want, that's going to drive up or down the cost. But it's not as cost prohibitive as people think. I definitely wouldn't allow that to be the do or die conversation for retiring. There's too many options.
Yeah.
And there's ministry plans.
And I say that's kind of his second question was kind of going into that. Like if say like a single officer doesn't have a family, doesn't have kids, single officer, but he doesn't have, based on what he's writing here, I'm assuming that's what he's asking. Insurance costs where they are, and that may cause officers to stay on longer to make sure that they're getting the insurance they're provided. So single officer has no family or friends, but they have options if they want to leave at 20. If they want to leave at 20 years instead of having to stick around longer because they need to keep insurance, I think is what he's getting at.
I think people overestimate that challenge. I think they're thinking of the old system, not understanding the new system.
Yeah.
It's there's definitely a monetary cost to it, but I mean, I don't know how much you guys pay for insurance now, and I think that varies by department,
Yeah.
right? So
Depending on what the city puts in, yeah, I would say that's probably
right. So obviously we have to do a cost analysis and how much more is it going to cost you to leave the department? Because the reality is, most group plans, which you guys are in a group plan, typically the employer pays at least 50%. Well, they have to pay at least 50% of the employee's cost of insurance. Okay. And sometimes they'll pay more. They'll pay 100% or 75%. They have the discretion to pay more, but typically it's 50% of the employee. They don't have to pay a cent towards the spouse or the children. They have to offer insurance to the children. They don't even have to offer it, make it available to the spouse. The group plan can say, nope, we're not going to cover any spouses. Regardless if the employer is going to pay a nickel towards the spouse, they can say, we're going to not allow spouses on here.
So if you're getting like a family plan, though, if it's somebody who has a family, how's that different then?
Well, as I'm saying, a family plan would include spouse and children, but there are plans out there in the group arena. When you start getting into private industry, the private sector, the businesses have a lot more control individually for their company of what they want to offer.
Okay.
Right. Reality is a lot of plans, depending on what plan they go with, there can be a claim requirement on there. So the cost of insurance for the whole group will be a collective of the claims from the whole group. So some employers, by a way, just in an attempt to control costs, will not allow the spouses to be on the plan. They'll say, nope, we're not covering spouses. Spouses are not allowed. If you want to add your family, or when you say family, in this case, it's just children. They have to, by law, offer to the children as well, even if they don't pay a nickel. Right? Let's just say you have 3 kids. You can say, you can put your 3 kids on it, but you can't put your spouse on it. That's pretty rare. Typically, it is an and family, and typically and family is spouse and children.
Okay.
Or it's and spouse. On those options, typically it's and spouse or and children. Right? So this is where it really varies, and companies have a lot of discretion of what they can do, and then you get into some very complex things. So what I remember you saying about this gentleman here is he was going to start his own company. So he really has, anybody who's going to start their own company, they have a lot of options in the healthcare situation.
Yeah.
A lot. They have no idea. There's level funded plans that are way more affordable where you can get refunds. There's self-funded plans. There's a lot of options, and nobody understands healthcare. That's why I got into it, health insurance, because I didn't understand it. At the time, my young family of 4, uncle, a doctor right across the street. We were paying $1,400 a month. Never used the plan once. Had the doctor on speed dial. Would come to the house, stitch up the kid's head, never charge us anything, right? And so it was ridiculous that we paid $1,400. And the only reason we paid $1,400 is because we bought out of fear. We didn't know. It's just like, hey, go buy good insurance.
Just in case. Yeah.
Well, we didn't realize what it was, right? So we bought it because what's good insurance, right? Tell me, what do you think good insurance is? Just throw it out there. Would you say high or low deductible is good insurance?
I guess it really depends on the person, but it's good insurance, I guess, would be.
It's hard to say, right?
Yeah, it is hard to say.
Nobody knows.
Yeah.
You're not alone. I'm not surprised you're going blank there. Nobody knew that.
Yeah.
So the point is people buy out of fear, right? That's the reality. They buy out of fear. They don't buy health insurance out of understanding and knowledge. They make it an emotional decision, right? Versus a black and white contractual decision. Buy it for what it is, not what you want it to be.
Yeah.
Very important. And once you kind of show people exactly what it is, their fear diminishes. It drops. Then it's just a dollar and cent situation. Either way, all of these plans have a stop loss in place. It's called out-of-pocket maximum. Anybody who's had to use their plan from a serious ailment knows about it. Those of us who have been fortunate enough to not experience that, we don't understand. We think that we have a $2,500 deductible, 80-20 plan, right? And I'm on a bet. So let's just ask you, if you have a $100,000 event, you're on a $2,500 deductible, you're on an 80-20 coinsurance plan. How much of that $100,000 bill is yours? You got to pay the deductible first, right?
Yeah.
So that's $2,500, right? And then you're on 80-20. So that leaves a balance of $97,500. And now you're in your coinsurance phase, 80-20. What does that mean to you? How much of that $97,500 is your responsibility? What's your guess?
20% of it then?
Is that your guess?
Yeah.
So you're saying 19,000 and change, right?
Sure.
Okay.
Yeah.
Is that what you're saying?
Yeah.
I would say 80% of Americans would say that, and that is not accurate, right? We all think that, so we're all terrified. We all hear that people having $500,000 worth of bills, so we think that 20% is going to leave us $100,000 in debt, right? We don't realize that co-insurance phase, the 80-20 phase, that 20% is only, and by the way, 80% is the insurance company, 20% is yours, right? But that 20% has a stop loss in place, and that's called out-of-pocket maximum. And so it's just 20% until that number in aggregate with your deductible reaches what's called out-of-pocket maximum. Most plans anymore, it's that out-of-pocket maximum is anywhere between $6,000 and $10,000.
Okay.
So whether you have $50,000 in bills or you have $2 million in bills, most you're going to be on the hook for is your out-of-pocket maximum, which is again typically between $6,000 and $10,000. So people buy out of fear. I definitely firmly believe that we buy these benefit-rich plans not understanding.
Yeah.
So I typically try to talk people off the ledge, help them understand. Just buy a safety net. Just make sure you're covered. Pay cash as much as possible. These plans are not designed for a little upfront cost, which is the challenge with you government employees, because you guys have had very benefit-rich plans. So you used to be able to go in and get chiropractic care benefits and pay the $25 copay and all that.
You get the PT, you get like what 12 is, whatever it is, 12 a year, and
you guys get a lot of stuff.
Yeah.
And that's a big slap in the face when you retire, because the individual market, the group plans outside of that arena
don't have that.
Yeah. So but again, if you actually pencil it out, you'd see, that's what I have to do. I have to pencil it out. I was like, let's save you a couple $100 a month in premium. Let's annualize that. So now it's $3,600 a year. If we save you just $300, well, that's $300 that we just freed up in cash. Well, how many times are you going to the doctor? A couple times a year. Well, who cares if you don't have a copay? Pay them $200 2 times. That's $400. You're still netted $3,200 in your pocket.
Yeah.
And that's before we get into any HSA conversations and any other tax conversations. I really focus on trying to drive my healthy clients into HSAs, even the group guys. Let's play the tax game. So unfortunately, not a simple conversation we started here.
Yeah, no, it's not. Because I just switched to the HSA, and I still don't know a ton about it. It was more of several people at work were talking about it, saying how beneficial it was, and that if you can get it, do the HSA plan. So
for anybody healthy, I absolutely agree. They're fantastic plans. The greatest thing about HSAs is that getting back to that out-of-pocket maximum. On HSA, out-of-pocket maximum is typically lowest. That's where you're going to find the cheapest out-of-pocket maximum typically. And then the great thing is it's a health savings account. It is a true savings account. It gives you a tax deduction up front, and you can fund. It's right around $4,500 a year if you're under 55. I forget the exact number. It always varies. I always have to look it up when I'm with my clients. But if you're over 55, I believe you can put an extra $1,000. So you can put in $5,500 into this savings account, whether you use it or not. And what people don't understand about HSA is they think they can only use it for healthcare, but you can use it towards dental costs, eyewear. If your doctor says, "Hey,
saunas,"
there's a lot of things you can
there's
use.
A lot of stuff I've seen it. There's a lot of stuff.
It's a massive list, and so why not use pre-tax dollars for that? And people don't understand. So they're just so scared and terrified of health insurance. They think they're going to do something wrong, that they fail to surround themselves with an expert who can educate them.
Yeah.
Right. And that's the whole premise. Again, the show, we run into that with all sorts of life when it comes to insurance or, the pension plans. It's just people, again, they buy out of fear. They don't know. They don't have the right advisors. They don't know where to find the right advisor. And health insurance is definitely one of those arenas.
Yeah.
You don't know who to trust. And definitely when you find a good health insurance guy or a woman out there, hold on to that person, because I've run into a lot of bad agents.
Yeah.
It's tricky. You better be smart. You've got to find somebody who's sharp, who can retain things, who's attending meetings and finding out what's going on, what's changing, what's evolving. The prescription drug arena is a crazy ordeal when it comes to these health insurance plans. So if you are in a situation where, I have a client who's paying $200 a month for their child, but the poor thing takes a $12,000 a month infusion, right? And so it's a big deal. Understanding how infusions work opposed to experimental medication. And so it's it's a big conversation, which I'm happy to continue having. So I'm glad we started this podcast here
Yeah, I think it sounds like we opened up a.
So put your mind at ease for you guys that are looking to retire in the near future. Okay, guaranteed insurance, guaranteed issues insurance is there for you. So don't worry about that if you have a loved one who has things going on in their life. Doesn't matter if they're in the middle of cancer treatments. It's not going to be a problem, right? We can find plans that can get you to that doctor. That might force you into COBRA to retain your COBRA for a little bit.
At least
temporarily, but it's not the end of the world, right? For those of you who are looking to have and start your own company, your own side hustle, who are looking to play the tax game a little bit, even if you're looking to do off duty, right? For any of you who are getting a 1099, well, you should be starting up a side company anyways to route that 1099 income through, right?
That's another one. We don't have to do it today, but that's definitely another topic I would like to dig into.
So when you start up your LLC to route that 1099, so that way you're getting that 1099 paid towards your LLC, well, all of a sudden, guess what? Employ somebody. You can figure out a way, or bring in another partner who also wants a 1099. You guys just want to route it through together. There's ways to work this so that you can trigger your own group plan. When you have the ability to trigger your own group plan, you are in control, right? Yeah. I'm choosing to pay $770 a month. I'm choosing. I don't have to do that. I can shop. I can't tell you. There's probably 600 plans out there that I can choose from. It's atrocious. Some are cheaper, some are more expensive.
Yeah.
Right? I'm not necessarily in the most expensive plan. There are more expensive plans than what I have.
Yeah.
By far. They're lower deductible, same network, but they're lower deductible, lower out-of-pocket maximum, cheaper copays, right? There's just a lot of people who feel they have spouses who are so scared of everything. I want the lowest deductible. I've got to have the cheapest copay.
Yeah.
They don't. I'm a business guy, so I like to annualize things.
I had Cigna for a long time and early on in my career, and it was super low copays, but you always had to go to their doctors for pretty much everything.
If you're into Cigna, people I know that are into Cigna, they love Cigna. They love that HMO world.
I had my daughter through Cigna, and it actually cost us like $400. It was dirt cheap.
Yeah, it's either love or hate, right? There's no middle ground with that demographic.
Yeah. And
typically it becomes you typically hate it when the last thing you want to hear is that the person that can fix you is out of network.
Yeah.
Right? Nobody cares.
That was the big thing.
That's the biggest thing. You know what I mean? We buy insurance because when you get hurt, you want to get fixed.
Yeah.
And so that's what you pay for, that ability. And I personally I'm thankful to be healthy so far, knock on wood, whatever. But when the time comes, if something shows up on my doorstep, well, I've got a good plan, but I'm paying a pretty premium for it. But again, because I have a business, it's also I have some business write-offs there.
Yeah.
Right. And but it's kind of funny. So you pay for it through the business, but it's still because of the way I'm formed, it still passes through back into my personal income and it's deducted there. So it's a bizarre situation when you start bringing in the tax side of this.
Yeah.
And this is where the HSAs, FSAs, the Section 125 plans, there's a lot to it. Just find a good agent, right?
Yeah.
And if you know any good ones, like the guy sitting to your left, yeah, just call me. Right?
Give him a call? Yeah.
Yeah. Give that guy a call. But, all right, cool. Well, I don't know. I think we've been talking here for a little bit. I don't know what it is, but it's probably enough for health insurance, huh?
Yeah, but it definitely opened up some other future podcasts, I think. I think it definitely so now I got things spinning in my head.
Write them down, man. And any of you out there, I mean, we really welcome your conversations and our questions, I should say.
It helps.
We want to answer those questions. We'd love to have you on as a guest on this podcast. The whole point of this is to peel back the confusion. We recognize that you guys are getting trained on a lot of things outside of your financial benefits in life. And so you've gone through a lot of additional training that, I don't want to arm wrestle you, dude. I don't want to go out there and try to see who can beat who up here, but when it comes to financial education, I think I've got you on that training side.
Yeah.
Right. And so it's perfectly reasonable that you guys are well trained in one area and not well trained in another. It takes a village. You know?
I mean, you really have to you have to seek it out yourself. And if you don't, then you could get to the end of the career and not know shit about anything that you're,
Well, and I've heard you tell some horror stories about people who got caught doing the wrong thing that really completely demolished their career from not handling their retirement situation correctly.
Yeah, guys not, like I said it in previous ones, like not maxing out their deferred comp when they could, when they had the ability to, and they weren't doing it. Just, just
Yeah.
little, but it's more about just knowledge, not knowing.
Right.
They didn't have somebody there telling them like, hey, dude, you should be pumping money into this thing right now. You got, no kids or, whatever it is. But yeah, just not having the knowledge out there, not having the info.
Well, we're going to change that.
Yeah.
Right.
Hopefully.
All right, man. Well, thanks again for, being part of this podcast. And we look forward to, hopefully educating and peeling back all the crazy layers that you guys have to deal with,
Yeah.
all your concerns.
Yep. Look forward to it.
So, here's the end of another segment, and we'll see you again soon, bro.
Yep. See you soon.
All right.